So I just wanted to post a video and talk a little bit about some of the ways that pelvic health treatment and pelvic physical therapists or myofascial therapists can help with scar tissue related to pregnancy and other pelvic issues. A lot of women have had C-sections, and I've never run into anyone that's been told that you can get that scar tissue worked on. It's becoming more commonly known, so it's very helpful. And most people realize how significant a C-section scar can be, but even years down the road, pulling or tenderness or pain, especially on the side where the suture might be, and that can be released fairly easily and create a lot more comfort, especially women are wanting to possibly have a VBAC where you have a vaginal birth after a cesarean, and getting that scar tissue worked on can improve and optimize the success with that. Even something that seems smaller, like a small vaginal tear or perineal tear with an episiotomy or just through delivery, even those stitches and scars can be worked on to help women avoid things like painful sex or, again, ongoing pulling or discomfort after baby's born. Then there's a LEEP procedure. Some women may be familiar with this. It's what's commonly done when there's any abnormal cells on the surface of the cervix. So when you have the opening of the cervix, they'll do a procedure to remove those cells and biopsy them, or just remove the abnormal ones that have already been determined to be there. It's very common. It's highly effective for avoiding progression of cervical cancer, but it can also cause scar tissue on the surface of the cervix. Some of the side effects or after effects of that procedure are more painful periods, as well as some difficulties dilating for women that get pregnant later. And that can also be scar tissue that can be released and treated. So I've worked on women that were literally in labor and having trouble dilating, and we were able to release that tissue and allow progression of their labor. But it can also be worked on when you're not pregnant, and just to make sure to avoid any of those other side effects or issues later. So again, just wanted to post this video, let people know about some of the ways that scar tissue can be quickly, fairly painlessly, and very effectively treated, so that you don't just suffer with these different things related to your pelvic health. Thanks so much.